Mental health has been on the decline for teens today, specifically with depression, and it has been negatively impacting their lives. Let's dive more into what depression looks like as a teen and an adolescent and how this impacts their well being and how this will further impact the community and the larger population's future. From the 2023 Youth Risk Behavior Survey Data Summary and Trends Report, it found 4 in 10 students have persistent feelings of sadness or hopelessness, 2 in 10 students are dealing with suicidal rumination, and 1 in 10 students attempt suicide. With suicidal rumination, 53% of females and 65% of individuals who identify with the LGBTQIA plus community are dealing with this more often, while 9% of students actually attempt suicide, with 13% being female and 20% being in the LGBTQIA community. Depression is more than just a teenager being sad, going through the hormonal ups and downs that come with entering adolescence. Depression can be something that deals with brain chemistry, the hormones that come with adolescence can also trigger depression in some teens, while also depression can be inherited genetically from either one parent or both sets of parents. Depression can also happen due to early childhood trauma and ACEs experienced during those times. But then depression can also come from a negative learned thinking pattern that is common within society today, especially in a very highly individualistic society. Some risk factors that can trigger or even perpetuate depression, then what can contribute to it would be a negative self-esteem, personality traits that are negative or otherwise point out deficiencies for the person. Now, as we touched before, anyone that identifies in the LGBTQIA plus community, they can already have more challenges stacked against them, which can lead to negative thoughts and experience with the people as well. And it can come from either being a victim of violence or witnessing violence. This can be anything physical, anything verbal, or anything that is directed at someone in a harmful way. It can also come from just those who might have learning disabilities, those who might have ADHD, ADD, or bipolar. So it can also be a comorbidity with other mental health issues as well. But some of the bigger ones that can impact outside of external factors would just be having a relative with depression in the family can make it more likely that someone is either going to have depression or is more susceptible to being triggered or adding to situations that could bring out depression sometimes. Now, also stressful life events can be very impactful on a person, and they can lead someone into depression, as stressful life events normally cause disruption in what a person knows, and how they cope and handle that change can spur a lot of different ways that their emotional health suffers during that time. Depression has a large impact on teens' schooling, social relationships, familial relationships, and their relationship with themselves and how they see their self-concept. Ways that we could support teens would be educating and implementing ways for teens to control self, promoting practicing self-care, building social support networks, and maintaining treatment if they are receiving anything for any mental health illness, but especially depression, and get the teens mental health services with a professional as soon as possible to help them figure out healthy ways to cope with their illness. As well as providing professional services for mental health, it would be important as well to start advocating, implementing, and promoting building connections within social groups, within the home environment, and within the community as well. From the readings I did with the CDC and Mayo Clinic, it identified how having a strong sense of connection with at least one of those areas, so at least with school, at least within the family, or at least within the community, can really help give someone who is struggling with depression someone that they can go to for support, and someone that can help recognize maybe when that person isn't doing well and can help them receive services that they might need. In building a connected society and connected groups and building that sense of connection, it would also be important to advocate, implement, and educate adults, children, youth, and start to look at how health policies are either inhibiting or allowing for social emotional learning to take place. And that would involve understanding what one's emotions are, how to actively handle and cope with emotions, and also understand what that emotion is trying to serve within the moment. And this would be something that would be very different for Americans since we're in an individualistic society. This would take time, and it would be something that in long term would be very beneficial, but it would take time to implement fully. But this would be great to help people with depression help recognize their own emotions, understand what they are for, while also understanding other people's emotions. And that also lets people within their support group offer support and notice when someone is not emotionally doing well. This graph further shows how since 2013, how mental health has increased for teens. And we can see here that in 2019, at the start of COVID-19, there is a spike in mental health crises. Specifically, this spike is dealing with depression, as COVID-19 brought a lot of restrictions, threw people out of their routines, and for some people, it gave a loss of purpose. Now, currently, as of 2013, the percentage of mental health crises and depression in teens has gone down, but it's still at 40% of the national population is dealing with depression. In conclusion, it is very important that we start looking towards the future of today's youth so that we can help build strong adults for our future, helping those adults understand how to get services when they need them, helping the youth then understand as a young adult and as an older adult the importance of taking care of your mental health, understanding that mental health can be a real illness in some stages of life, while others it is a lifelong illness that you have to learn how to take care of. And this can help reduce the instances of unsafe treatment of certain illnesses or self-treatment, such as using drugs, or over-consuming alcohol. All those negative health impacts that impact more than just their mental health. It also starts impacting their physical health. It also starts impacting their social and familial relationships as well. So mental health and helping teens understand what depression is and understanding how they can get support and helping improve policies so that is more widely taught and educated, it's essential.